Facing a medical test can bring up many questions, especially when it involves something as important as your brain and spinal cord. You might be wondering about a procedure often called a spinal tap and what exactly it entails. A spinal tap, also known as a lumbar puncture, is a medical procedure where a small amount of cerebrospinal fluid is collected from the lower part of your spine. This fluid surrounds and protects your brain and spinal cord, and analyzing it provides doctors with crucial information to diagnose various neurological conditions. Doctors perform this test to look for signs of infection, inflammation, or other diseases affecting the central nervous system. By examining the fluid, specialists can detect abnormal cells, specific proteins, or changes in pressure that can point to conditions like meningitis, multiple sclerosis, or certain cancers. It is a key diagnostic tool because the fluid offers a direct window into the health of your brain and spinal cord. The process begins with your doctor thoroughly explaining the procedure and answering all your questions. You will typically be asked to lie on your side with your knees pulled up to your chest or to sit leaning forward. This position helps to open the spaces between the vertebrae in your lower back. The area will then be cleaned, and a local anesthetic will be injected to numb your skin, making the procedure much more comfortable. Once the area is numb, a thin, hollow needle is carefully inserted between two vertebrae into the spinal canal. You might feel some pressure, but generally not sharp pain. A small sample of cerebrospinal fluid is then collected. After the fluid is taken, the needle is removed, and a small bandage is applied. Following the spinal tap, you will typically be asked to lie flat for a period to help prevent a headache, which is the most common side effect. Staying well hydrated by drinking plenty of fluids is also highly recommended. Your body naturally and quickly replenishes the cerebrospinal fluid that was removed, so there is no long-term shortage. Understanding that the body constantly produces and reabsorbs this vital fluid helps illustrate why taking a small sample for diagnostic purposes is safe and effective. This diagnostic procedure provides invaluable insights into your neurological health, allowing doctors to make accurate diagnoses and guide appropriate treatment plans. Knowing what to expect, from the preparation to the aftercare, can help reduce anxiety and empower you to feel more comfortable with this important step in understanding and managing your health.